and just behind the jowl, towards the angle of the mandible, the jawbone, we can actually disguise the jowl into a straight line. So people... Hi there, my name is Dr Kandola and I'm going to be talking to you about how we can minimise jowls. So this is one of the FAQs I had. Before I get into that, if you liked the video, press like. If you loved it, press subscribe and you can get more of my content. So, straight on into the questions then. The first question I had was, what is a jowl? Well, that's a good question. Essentially, a jowl is a loosening of the skin here, leading to a kind of slackening at the jawline. So that's essentially it, really. I suppose what you could extend that to is sometimes it's solely skin, and that's if someone's quite thin. Sometimes if someone's carrying more weight in the face, then it can also include fatty tissue, which is a key differentiator for treatment necessity. Which brings me on to the second FAQ, which was, how do I treat it? Well, there's a few mediums that one can treat the jowl area. The first, probably most regularly occurring in the slimmer face, or in the face which doesn't carry a lot of fatty tissue, is dermal fillers. So paradoxically, sometimes adding some volume into the area here, which is called the pre-jowl sulcus, so people think, oh, well, that's going to make my jaw look big. Not at all. As you'll see from the photos at the end of this video, that will be marked jowl with filler, it's quite clear what I mean. And then perhaps someone who's got a slightly more progressive jowl might require some lifting as well. So I do that with PDO threads. And also you can lift the neckline with botox. And botox can be done in these muscles here. If you look on my neck now, it just pulls down. And that's a muscle called the platysma muscle, which is a sleeve-like muscle attached to the jawbone down to the clavicles. And its job is to pull the face down. So if I relax it, then you'll get a consequent lift because it's no longer able to pull the face down. Another very good treatment, probably more relevant for people that have got a bit more fatty tissue here, would be Aquilix. Now Aquilix is a fat dissolver, and fat dissolvers are permanent, but they do require about 1 to 3 treatments. So Aquilix in the face here and here would minimise some of the heaviness under the chin, and with relevance to the jowls, heaviness of the jowl area. So once that's active, the fatty area will decrease, but consequently you may have some loose skin, in which case you follow on the treatment with either dermal filling or PDO threads or a combination of the both. So I'd say they were the main ways of improving the jowl area. If you have any questions or queries, then just direct message me on Instagram or send me a message on Facebook. My email contact details are below the video, and I look forward to hearing from you.